One of the questions that comes up is often people want to know that they've injured their back repetitively over a period of time, but why did their back, in quotes, go when they went to pick up their toothbrush? Well, what tends to happen is the core muscles, the muscles that form the abdominal wall and the back muscles support the spine. And the best way to think of these muscles is they act like a dampener. So what happens is when you go to bend or lift, the muscles take the weight of the body and they take that stress and that strain. Now, yes, those muscles can then ache and become tight and uncomfortable, but that's the muscles doing the job that they're supposed to, and then over time they get stronger. When you've been sitting for a period of time, or if your spine's misaligned, it can affect the neurology. So a joint can get misaligned. That can affect inside the joint something called a mechanoreceptor, which is a pressure receptor. When that misalignment happens, that switches off or inhibits core muscle function. So what happens is when someone then goes to bend and lift, instead of the stress of their body going into the muscles, it goes into the ligaments and discs in the spine. When that's been happening over a period of time, that starts to lead to a stress of those ligaments, and like if you take an elastic band and pull it, it goes back into place. If it gets overstretched, it can mold and change shape. And if it carries on, it can snap. It's exactly the same thing that happens to the ligaments and the discs in the body. So if it's just pulled, we call that a grade 1 sprain. If you start to get tears, that's a grade 2 sprain. And so what happens is when your body's bending and lifting repetitively, it gets to a critical point where suddenly those structures can fatigue and get damaged. And that's usually when someone injures a disc.